Hey all, so today we are going to discuss about some topics of forensic odontology. In the previous video, we have discussed about the definition part of forensic odontology, what forensic odontologists do, types of identification procedures, comparative dental identification procedures, right? So now in this video, we will discuss about the reconstructive type of dental identification procedure, right? So now what is reconstructive dental identification procedure and why we use it, right? So as the name suggests, reconstructive. So it means that we are supposed to reconstruct the identity of that individual, of that dead subject basically, right? So in this procedure, we are supposed to extract the information such as the ethnicity, the sex and the age of that deceased, or you can say the dead subject basically. So the next question is why we use reconstructive type of dental identification procedure. So this procedure is used only when no clues exist about the identity of the descendant or the dead subject, right? For example, if we have recovered a skull in a desolate location, so there are no clues about the ethnicity, sex or age of that individual or anything about that individual, right? So in those cases, we are supposed to extract all the information from that remains only, right? In those conditions, we use reconstructive dental identification procedure basically. So now we are going to discuss about identifying the ethnicity from teeth only. So there are basically three races. The first one is Caucasoid, second one is Mongoloid, and the third one is Negroid, right? So to identify the ethnicity, we are having two traits, or you can say two methods. The first one is metric dental traits and the non-metric method, right? So in metric, or the term metric means differentiating on the basis of tooth size, whereas non-metric means to differentiate on the basis of presence or absence of a particular dental trait, right? So the recommended approach for this to evaluate is non-metric dental traits only. So the first non-metric dental trait is shoveling. So shoveling basically means presence of mesial distal marginal ridges basically on the lingual surface of anterior teeth, right? If the marginal ridges are prominent, then the fossa will also be pronounced, that is the lingual fossa. Lingual fossa will also be pronounced in those cases, right? So shoveling was not found in the heterogeneous Indian samples, right? So now we are going to discuss about the caramelized trait, right? So this is the second non-metric dental trait, right? So as we know that there is a special cusp known as caramelized cusp or tubercle of carabeli, right? Which is present on the palatal aspect of the mesiopalatal cusp of the maxillary first molar basically. Maxillary first molar. So in few cases it is present and in few cases it is not present. So in Indians it is reported to be present in 26% of the population, right, of Indian population basically. Now the third dental trait is three-cusped maxillary second molar. As we know that the maxillary second molar is having four cusps, right? But in few cases the distopalatal cusp tends to be reduced, or you can say absent, right? Basically on maxillary second molars, right? So caramelized trait was about the special cusp which was present on the maxillary first molar, but the three-cusped maxillary second molar trait is basically the absence or the reduction of the distopalatal cusp on the second molar or the maxillary second molar basically. Now the fourth trait is winging. Winging is basically an indirect crown trait. So in this case, what happens? There is bilateral labial rotation of the distal margins of the maxillary central incisors. Though maxillary central incisors are present in an arch, but sometimes what happens? This maxillary central incisor tends to get rotated, right? Basically from the distal aspect. So bilateral labial rotation. So if this is the labial aspect and this is the labial and this is the lingual aspect, and suppose this is the incisal surface of the central incisors, you can see, right? Then what happens? The distal aspect or the distal margins of that central incisor tends to rotate labially, right? So this is winging. Winging is basically present in 16% of Indian population. Now the fifth trait is cusp 5. So in cusp 5 there is presence of occlusal tubercles on the distal marginal ridge of maxillary molar. So particularly maxillary first molar. So there is presence of occlusal tubercles, or you can say an extra cusp on the distal marginal ridge, right? So this trait is basically present in 75% of Indian population, right? Now the sixth trait is cusp 6. So additional cusp between distal and distolingual cusp of mandibular first molar. Till now we have discussed about the maxillary traits, right? Maxillary molar traits. Now the cusp 6 is present on the mandibular first molar, right? So this is a cusp which is present between distal and distolingual cusp, right? So it is referred to as cusp number 6, right? So this trait is present in about 57% of Indian population, right? Now the cusp 7, that is the seventh trait, which is an additional cusp between the lingual cusp of mandibular molars. So there are lingual cusps present in the mandibular molar, and in between them there is an additional cusp which is termed or referred as cusp number 7. So this trait is present in about 21% of Indian population, right? Now the eighth trait is four-cusped mandibular molars. So as we know that the mandibular first molars are having 5 cusps, right? And the second molars are having 4 cusps. So what happens? Sometimes the distal cusp may be absent on the first molar, right? And giving it a 4-cusped shape, right? And it can be expressed on the second molar, right? So however, the distal cusp may be absent on the first and or expressed on the second molar. Therefore, both the first and the second molars are studied for the absence of the distal cusp, right? So the 4-cusp mandibular molar trait basically, right? So the frequency of 4 cusp is about 11% in mandibular first molars and 90% in mandibular second molars, right? So now the non-metric features of root. So these are 2-rooted upper premolar, 2-rooted upper molars, 2-rooted lower canine can also be there, 3-rooted lower molar and single-rooted lower molars. So these are non-metric features of roots, right? So till now we have discussed about how to identify the ethnicity from teeth. Now the second step for the reconstructive dental identification procedure is sex determination. So for sex determination we can differentiate male and female on the basis of skull features. So the skull features are as follows. So the first one is size of the skull. So as we know that the males are having bigger size of the skull, whereas females are having smaller size of the skull. So the frontal and parietal eminences are smaller on the males, whereas it is larger on the female skull, right? So the forehead of the males are basically sloping, whereas females are having vertical forehead. The supraorbital ridges, right, the ridges above the orbit of the individual are basically medium to large in size, whereas females are having small to medium sized supraorbital ridges. Now the glabella portion is basically curved in males, but it is flat in females. The glabella basically in between the orbits or nose, or you can say, right. Now the orbits are basically square shaped in males, but it is rounded in females. The nasal apertures are at higher level, right, whereas in females it is at lower level. Now the zygomatic arch, it extends basically, but in females it doesn't extend. The occipital muscle lines are marked in males, but it is not marked in or not prominent in females, you can say. The mastoid process is medium to large in size, right, whereas in females it is smaller to medium in size, right. The occipital condyles are larger in males than in females. The glenoid fossa is very deep, whereas in females it is superficial, or you can say it is shallow, right, not deep. The foramen magnum is very large and long in males, whereas in females the foramen magnum is very small and round, right. The palate of males is basically large and U-shaped, whereas in females the palate is relatively smaller, right. So these are the skull features upon which we can differentiate between the males and females, right. Now differentiating males and females on the basis of mandibular features. So generally mandible of males are basically larger and broad ascending, whereas in females it is small or narrow ascending, right. So as we know that the mandible is having two processes, the condylar process and the coronoid process, right. So the condyles of the males are basically larger in size, whereas in females it is smaller, right. Now the shape of chin. So the chin of males is basically square in shape, whereas in females it is round or pointed, right. Now the gonial angle. So gonial angle is basically this is the gonial angle basically, right, angle of the mandible, you can say, right. So it is less obtuse in males, whereas it is more obtuse in females, right. You can say it is in males the gonial angle is relatively acuter. Now the body height, in males it is having high symphysis, whereas in females it is having, the mandible is having low symphysis, right. Now what is symphysis? Symphysis is basically where the left and right sides of the mandible or aspect of the mandible fuses, right. So this is the symphysial area, you can say, and the body height of males was higher than in females. So females were having low symphysis, right. How to check the height of the symphysis? It is basically from the most higher point on the alveolar ridge, right, to the menton, right. So now we can differentiate gender on the basis of tooth size also. So male dentition is basically larger than the female primary or permanent dentition, right. So sex is determined from the tooth measurement using statistical methods, which is known as discriminant function analysis and logistic regression analysis. So this is the way via which we can differentiate the males from females via tooth size, right? So now sex determination by DNA analysis. As we know that we can extract DNA from the tooth also. So now there is AMEL GENE, which is a major matrix protein. This major matrix protein is basically secreted by ameloblast. Ameloblast are basically the cells of enamel, right? So these ameloblasts secrete AMEL GENE, which is basically a protein, right? So it is present on the AMEL gene, right? It is present on both X chromosome and Y chromosome. So this particular gene is present on the both the chromosomes. But what happens? This gene is similar or identical on the same chromosome, right? So females have basically identical AMEL gene, right, which represents AMEL GENE basically, and males are having non-identical gene. So on the basis of that we can determine the sex of the individual. So if the person is having two identical genes, right, so we can suggest that the individual was a female, right, or having XX chromosome. But if there were two non-identical genes present, then we can say that the individual was a male, which was having XY chromosome, right? So till now we have discussed about how to determine the ethnicity, how to differentiate between the genders of the individual. Now the third step in the reconstructive dental identification procedure is dental age estimation, right? So now the age estimation in prenatal, neonatal and early postnatal period, right? So the first thing is primary tooth germ starts to form at the 7th week in intrauterine life, right? So it starts to form at 7th week in intrauterine life, but it begins to calcify at about 12 to 14 weeks of intrauterine life. So the primary tooth germ starts to calcify, right, at this period, right? Now the enamel formation of deciduous teeth is usually completed by first year of age, right? And the third thing is permanent first molar germ formation takes place at 3.5 to 4 months of intrauterine life, right? But it begins to calcify at the time of birth, right? The neonatal line. So this line is basically formed due to slowing down of enamel prism growth rate, or you can say slowing down of enamel formation, right? So it creates basically an apparent line of demarcation. That's why the name neonatal line, right? So it is basically an indicator of birth, or you can say indicator of a live birth. But it takes up to 3 weeks after birth to form. So presence of this line suggests that the child was alive at birth, right? But as we know that it takes up to 3 weeks after birth to form, hence a false result may be produced if one were to conclude that the absence of neonatal line indicates stillbirth. It is not true. It takes up to 3 weeks to form, right? Now Stack has also tried to estimate the dental age of the child. So he measured the dry weight of combined all the teeth basically, right? So the combined weight of all the teeth at 6 months of intrauterine life was only 60 milligrams. But at birth, right, the combined weight was 0.5 grams. At the time of, or at the age of 6 months after birth, the combined weight of whole dentition was 1.8 grams. So it was suggested by Stack, who measured dry weight of the teeth basically. So till now we have discussed about age estimation in prenatal, neonatal and early postnatal period. Now we are going to discuss about age estimation in children and adolescents, right? So two events may be used to measure dental age in children and adolescents, that are tooth eruption event and tooth calcification, right? So tooth eruption event is basically or should be limited to deciduous dentition only, right? Whereas tooth calcification event are more appropriate for permanent dentition, right? So why we say that tooth eruption event should be limited to deciduous dentition for age estimation? It is because the primary dentition eruption is basically under the control of genetics, right? So it is very regular basically, right? On the other hand, the eruption patterns of permanent dentition are influenced by intraoral environment and affected by infection, arch space, premature tooth loss, etc. So for tooth eruption event, it should be limited to deciduous dentition only, right? So now why we say that tooth calcification event is more appropriate for permanent dentition? So it is because calcification of teeth can be observed on radiographs, right? It is not altered by local factors such as lack of space, over retention of deciduous teeth, etc. Right? Or any of the environmental factors you can say, right? Now the Schour and Masseler's method. So the chart of Schour and Masseler was the first attempt to estimate the dental age. This chart described 20 chronological stages, right, of tooth development basically, starting from 5 months of intrauterine life to 21 years of age. And there was a chart that they published, right? The chart or atlas is based on histological sections and permit direct comparisons with radiographs, right? So this chart basically gave a detailed representation of tooth development at every stage, that is at deciduous dentition stage, at mixed dentition stage and at permanent dentition stage, right? So this picture is taken from the textbook of oral pathology, that is SHAFER'S, right? Now the next method is Demirjian's method, and this method used mandibular left side teeth basically to estimate the age of the individual. Mandibular left side teeth, right? So this method originally excluded the third molar, but after modification it included third molar as well of the left side, right? So in modified method, the calcification of teeth was divided into 10 stages, right, which was numbered from 0 to 9. So this is basically the 10 stages which was given by Demirjian and co-workers, starting from 0 to 9, right? So each tooth development stage was determined via this chart only, right? And a corresponding maturity score was given. So considering the differences in tooth development between males and females, so separate maturity scores for each sex was given, right? So here in these charts you can see the maturity scores for males as well as females, right, for particular teeth basically, starting from stage 0 to 9 and for tooth number 31 till 38, right? Now till now we have determined the stage of the individual, and after that from the chart we have seen the maturity score for that particular tooth, right? Now scores of each tooth should be added and a S value is obtained basically, right? and we have to put that value in these formulas to determine the age. These formulas are also having a certain error, or the average error is basically 1.43 years. These formulas were given by Acharya. Okay. The third molars, these are also valuable indicator in estimating the age, right? Whether the individual is in between 16 to 23 years. When all the four molars, right, all the four third molars basically are completely calcified, we can say that the age of the individual is greater than or equal to 18 years, right? So this is very important. Now, age estimation in adults, for that purpose there is Gustafon's method, and this method of age estimation was based on morphological and histological changes of the teeth, right? So this method assessed changes such as atresion, denoted as A, secondary dentine deposition, which was denoted by as S, apical migration of periodontal attachment, denoted as P, cementum apposition at the root apex, denoted as C, root resorption at apex, that is R, and root dentine translucency, denoted as T. So these were the changes which were assessed by Gustafon, right, to estimate the age of the individual in adults. So Gustafon basically assigned 4 grades, right, ranging from 0 to 3 basically, right. So a tooth can have any one of 4 grades for a particular variable, such as a variable can be atresion basically, right. If we consider atresion as a variable and it is denoted as A, so this can have grades such as A0, A1, A2, A3. Like that, other variables can also have similar grades. For example, apical migration of periodontal attachment can also have, which is denoted as P, can also have grades such as P0, P1, P2 and P3. Like that. So all the grades of the variables should be added and a total score is obtained, which was denoted as X, right? So this X or increase in the total score will suggest that there is an increase in the age of the individual. So there was a formula which was given by Gustafon, which is age is equal to 11.43 plus 4.56 into X. X was the total score, right? So average error was about 8 years for Indians and original method error was about 3.6 years, right? For that purpose, Johnson gave 7 grades, right? From 0 till 3, right? And at a difference of 0.5, right? The stage grade 1 was 0, grade 2 0.5, then 1, 1.5, 2, 2.5 and then 3, right? And after that a modified formula was given. This is the formula, right, with the modified grading system as well, right? And it is observed that the more the number of teeth used, more accurate was the age estimation. Now the root dentine translucency can also be checked to determine or to estimate the age in adults basically, right? So it starts becoming translucent in the third decade of life, right? Starting from the apex towards the CEJ. CEJ is cemento-enamel junction. So the diameter of dentinal tubules, right, which is basically present inside the dentine, decreases as a result of increased intratubular calcification. So the diameter of dentinal tubules is basically decreased, right? This will cause the refractive index, that is Ri, or the refractive index of intratubular organic material to be nearly equal to extratubular inorganic material, right? So Acharya measured maximum translucency length, which was starting from the apex towards the CEJ, and gave a formula that is age will be equal to 13.39 plus 2.812 into T, right? The translucency length was denoted by T only, right? But the junction between translucent and non-translucent zone can sometimes be highly irregular. For that purpose, the age is equal to 13.86 plus 1.06 into TA, right? So TA is basically translucency area. Before that we were measuring the length only, but after modification the translucent area was measured. So this was more reliable than the translucent length, right? So translucent area is denoted as TA, right? Now the next method is age estimation from incremental lines. This method used mineralized unstained cross section of teeth in order to count the incremental lines of the cementum basically. So this method is very much cumbersome and the authors found it very difficult to obtain repeatable counts of cementum lines in the same area of tooth section basically. So it is very difficult to count the lines or incremental lines of the cementum basically, right? So now age estimation from pulp to tooth area ratio. So in this method we are supposed to measure the area of pulp chamber and tooth area of the canines basically, right, on radiographs. So in order to get pulp to tooth area ratio, which is denoted as PTR, right? This method is based on secondary dentine deposition. As we know that with increase in age there is an increase in deposition of dentine, right? So there will be a decrease in the area of the pulp chamber. So the age can be calculated through this formula and the average error was about 10.76 years, which is basically acceptable in forensic age estimation methods, right? So we have discussed all about reconstructive dental identification procedure in which we have determined the ethnicity of the individual, estimated the age and determined the gender of that deceased or dead individual basically.